A very good afternoon and a warm welcome to the dignitaries and distinguished guests who have joined us today from various parts of India on this momentous occasion. While we move ahead for the event, let's have a look of the corporate video of Indian Immunologicals Limited.
It's a beautiful world. The coexistence of animals, human beings and ecosystem in a healthy and disease-free environment is called One Health, the hallmark of Indian Immunologicals Limited or IIL. IIL was established by the National Dairy Development Board NDDB in 1982 under the visionary leadership of Dr. Verghese Kurian. IIL's new research facility and human vaccine manufacturing facility were inaugurated by the President of India, Dr. APJ Abdul Kalam in 2003. Research team focuses on scientific discoveries with an aim to develop new and improved human and veterinary vaccines using platform technologies. IIL rolled out several novel products for human and animal health, such as theileriosis vaccine, combination vaccines, vaccine against porcine cysticercosis. IIL developed many vaccines indigenously. R&D pipeline has several new human and animal vaccines to be rolled out in the near future. Collaboration with several international institutes enables IIL to run multiple research projects at the same time. IIL has state-of-the-art manufacturing facilities to produce human and animal vaccines in multiple locations. IIL is the largest producer of human anti-rabies vaccine, Abhay. Many products at IIL are brand leaders in their segment. IIL manufactures a range of world-class human health vaccines, animal health vaccines, high-quality formulations, and nutraceuticals. IIL has a consistent track record of maintaining the highest standards of quality with advanced quality management systems which meet international regulatory requirements. Quality is imprinted in everything that IIL does. IIL constantly strives to achieve customer delight and happiness. IIL is one of the best places to work at. Learning, challenges and opportunities, work-life balance, environment-friendly ambience are some of the major attractions at IIL. IIL's Gachi Bauli hosts several species of birds, insects, animals and trees, much to the delight of visitors and WWF. The hallmark of IIL lies in its commitment and care for the society. IIL made significant contribution to the disease control programs in India and in several other countries. IIL's footprints can be seen in its best business practices, providing unmet needs in the vaccine industry, resulting in customer delight. Welcome aboard. Welcome to IIL.
To commence this event, it's my pleasure to invite Mr. Shakul Srivastava, Vice President, Human Health Business, for his welcome address.
A very good afternoon to all the dignitaries, esteemed guests, and my colleagues. I welcome each one of you on this momentous occasion as we come together to celebrate the launch of first indigenously developed hepatitis A vaccine. I am truly honored to welcome our chief guests, Shri Nagaraj Karpan ji, the MLA. Thank you so much for taking out time to come here, sir. I would like to welcome Shri Ajay Mishra ji, the IS officer and chairman of Indian Red Cross Society, Telangana. Thank you so much for taking out time, sir. I also welcome our speakers for the day, the doctors, Dr. Raghavendra Babu, Chief of Liver Transplant Department, Star Hospitals, Dr. G. Srinivas Reddy, consultant, clinician, and transplant hepatologist, Dr. Y. Rami Reddy, senior consultant, gastroenterology, and Dr. Ashish Chauhan, consultant physician, Apollo Hospital. Sir, thank you so much. I thank each one of you. And it's truly my privilege and honor to welcome the Managing Director of IIL, Dr. K. Anand Kumar. Thank you so much, sir. It is your visionary leadership that IIL is seeing this day. And under your leadership, we have seen several milestones, including this vaccine today, which is entirely developed in our country, indigenous. I welcome our Deputy Managing Director, Dr. Priyabrata Patnaik, and all my colleagues from IIL. The new vaccine is a result of extensive research and development efforts by IIL dedicated team of scientists and researchers. This launch event serves as a crucial platform to not only unveil a groundbreaking vaccine, but also foster collaboration and knowledge sharing, paving the way for advancements in immunization and public health. So when we have been mentioning about this is the first indigenous vaccine which is developed for hepatitis A in our country, I was really thinking it is that, have we done it for the first time? And then when I look back, here's a glimpse I would like to share with all of you, that it's not just science, but in several other spheres, several other walks of the business we do, we have been the first. Other than this, what we have done for the first time, just few examples I would like to give. We developed the first purified Viro rabies cell vaccine of India. So that's one first. The first company to develop world's first porcine vaccine for porcine cysticercosis. We became the first company to deliver our vaccines by drone in extreme part of northeast India. So you know that those terrains are very tough and it takes several hours even for a short distance. We became the first company to implement artificial intelligence enabled marketing officers, because as life gets busy, we keep abreast with technology, and that's how it is. So we became the first and probably one of its kind in the world to have this. We are the first pharma company to do business through e-commerce platform. And we are very aware we are into the scientific business, absolutely, vaccines, etc., which are high science products. So this platform completely complies with all the regulations and law of the land. Also, we are the first company to venture into fish vaccines. So these are just the few examples where we are first. So then we realize becoming first, or we have been doing this, and probably it's in our DNA, and we'll continue doing so going forward. So thank you so much for this. And I once again, without taking more time, I take out this opportunity once again to welcome each one of you who have taken out time out of your busy schedule to come to this event. And I look forward of this opportunity to listening to experts and exchange of insightful thoughts that our speakers have, and then few questions answered we'll take. Thank you once again.
Thank you, sir, for your welcome note and the brief on the event. As per our tradition, we begin every celebratory occasion with a sincere prayer to Almighty, seeking the blessings. As we commence this divine event, I would like to request the dignitaries to please join the stage for lighting of the lamp. This symbolizes our reverence towards the Almighty. It's my honor to invite our chief guest, Shri Nagaraj Karpan, Member of Legislative Assembly, Telangana. Our chief guest, Shri Ajay Mishra, IAS, Chairman, Indian Red Cross Society, Telangana. Our Honorable Managing Director, Dr. K. Anand Kumar. Our Deputy Managing Director, Dr. Priyabrata Patnaik. Dr. Raghavendra Babu, Chief of Liver Transplant, Star Hospital. Dr. Ashish Chauhan, Consultant Physician, Apollo Hospital, Sikandrabad. Senior Vice President, Manufacturing, Mr. Mukul Gaur. Vice President, Human Health Business, Mr. Shakul Srivastava.
I thank all the dignitaries for joining us in the lighting of the lamp. Your presence adds a special warmth to this occasion. We are grateful for each one of you for being a part of this event. As we embark on this momentous journey of launching groundbreaking vaccine, it is only fitting that we hear from our leader whose foresight and guidance have been instrumental in shaping our path. It's my absolute honor to invite our visionary leader, Dr. K. Anand Kumar, Managing Director of IL, to grace the dais with his keynote address, please, sir.
Respected Sri Ajay Mishra Ji, Commissioner for Indian Red Cross, Sri Nagaraj Garu, Member of the Legislative Assembly, Telangana, guest speakers who have been invited to provide us more knowledge about hepatitis A, our customers who have supported us all along this journey, colleagues from Indian Immunologicals, and various other parts of the country who have come here for this auspicious occasion, and beloved press members who have carried all our good stories so far. It is an honor and privilege to be here on this momentous occasion as we actually are witnessing a piece of history, because this is the first vaccine in India for hepatitis A. So far, we have been importing this vaccine from China, and this was being sold by multinational companies. And today we have an opportunity where we are a true example of Atmanirbhar Bharat, where this vaccine will be made in India henceforth. I want to tell you about our company in brief. We are a company established by National Dairy Development Board in 1982. We were created just to make only one vaccine. As a part of Operation Flood, there was a desire to make India sufficient in milk production. So one of the objective was to create a company which will make vaccines which will be used in cattle so that it will prevent disease, so that milk production will increase. That was very, very simple. So we started with just one vaccine, which was for foot and mouth disease vaccine in 1982. That time when we started this company, the price of FMD vaccine, foot and mouth disease vaccine, was 14 rupees, sold by a multinational company. And the price of milk in 1982 was 7 rupees. After 40 years, we are selling FMD vaccine at 18 rupees, and the price of milk, you all can guess, it's much above 50 rupees. So this is our contribution towards India. India currently requires about 900 million doses of foot and mouth disease vaccine, and outside of India, the same vaccine is sold for $3 a dose. So being in India, producing India offers us tremendous advantage. From one vaccine, we started developing several vaccines for cattle. Then we went into sheep and goats. We made several vaccines for sheep and goats. We are the only producer in India for companion animal vaccines for dogs. And we also have several other vaccines which we produce for pigs as well. We are not into poultry. In 1998, based on the request from Government of India, we entered into the human vaccine business. Our first vaccine was rabies vaccine for human, and at that time, there was some question mark asked about how good will a veterinary vaccine company be in making human vaccines. So today I want to tell you that we are the world's largest producer of human rabies vaccine. And from human rabies vaccine, we developed several other vaccines, including DPT vaccine, recombinant hepatitis B vaccine. Also, we developed a pentavalent vaccine, and this year alone, we have launched 3 vaccines, which is measles rubella vaccine, TD vaccine, and also now the hepatitis A vaccine. This work has been because of the tremendous effort put in by our research and developmental team. And also in the presentation, you would have seen that we have collaborations with various leading institutes across the world. And this work has been intensively going on for last 8 years. Our company has put in a lot of money and resource into development of this vaccine, and I'm very glad that we are dedicating this vaccine to the nation. Hepatitis A is a disease which there's about 100 million cases of hepatitis A in the world. 15 to 30,000 people die of hepatitis A. And definitely the use of this vaccine will significantly help reduce the incidence of both clinical cases and death. It's a foodborne disease. Basically, poor sanitation and hygiene are responsible for the spread of this disease. Unfortunately, it's very difficult given our population numbers and given our culture. It's very difficult to live in a very, very clean and hygienic manner. But in the absence of which, definitely this vaccine will be of very, very helpful to prevent and control disease. I'm sure I thank all of you for coming here, and you are actually witnessing a part of history now, and definitely this vaccine will go a long way in saving precious lives in India and abroad. We also export vaccines to about 50 countries. Once we have done the launch here and once we have catered to our population, we'll also export this vaccine to many countries. With these words, I thank you all for coming here, and I request all of you to support our company for what it is. Thank you.
Thank you, sir, for your inspirational address. Your leadership is a guiding light, steering us towards the future of innovation, progress, and improved global health. Thank you once again for your profound insights. We look forward to continuing the stride under your visionary guidance. Well, distinguished guests, as you all know, Indian Immunological Limited has consistently attained commendable milestones across diverse domains, such as research and innovation in vaccine development, manufacturing, and distributions. Our vaccine has been synonym with trust and protection, reflecting our firm commitment to public health. It's indeed an honor to invite our Deputy Managing Director, Dr. Priyabrata Patnaik, to share his insights on innovation in vaccine development. Please welcome, sir.
Thank you for the invite, and dignitaries on the dais, and my dear colleagues and invited doctors. Very much pleased to be here. I'm going to give you a little bit of glimpse of what Dr. Anand just briefly touched. It is a tremendous effort of research and development from the side of IAL to bring this product to the market, and this is an effort to just give you a glimpse what it took in the back end to get this vaccine, starting from an R&D to come to this stage of launch. Next slide, please. So as you hear and you have seen, that is on the materials that you have received, the product name is Havisure. This is a registered trademark of IAL's hepatitis A vaccine, and this is a registered product with trademark assigned to us. Next slide, please. And this is the product which is manufactured in our facility in Gachibowli. There are 4 different facilities that we have in multiple different locations. Gachibowli is one of them. We have a site 100 kilometers away from the city of Hyderabad called Karagpatla in Genome Valley 3. That also a site where we make human vaccines. There is another new site we're actually developing in Karagpatla as an additional manufacturing site. There is a site in Ooty where we produce rabies vaccines, and we also has a manufacturing site in New Zealand. And we are hoping that someday we will possibly step into Africa and we'll also have a manufacturing site. The site that you see here in the picture is a Gachibowli manufacturing site. This is where all the products on human health has been manufactured. I won't read into the details, but you will see every human vaccine product that has been manufactured at a much higher number of scales in millions, whether it is rabies vaccines or DPT, tetanus, or pentavalent vaccines. This is a site, it's a much bigger site. You can see it's 213-acre site, but with a built-up area of 60,000 square meters, where we maintain within a city a green cover that unlike any other vaccine manufacturing sites. I'd also briefly like to touch about how this product is manufactured. If you go to the next slide, please. This is where the vaccine, typically we call it as a drug substance and a drug product. Roughly, drug substance means that is the bulk that we manufacture and then gets blended to product, the drug product, which gets into the vial. Drug substance is just starts with a simple cell culture process. As you see the next picture, it talks about where the cells are infected with virus. Keep in the previous slide, please. Just the cells are infected with the virus. It goes through a centrifugation step where it goes through a clarification. Virus inactivations, because it's an inactivated viral vaccine, this goes through a step of inactivation, multiple steps of purification, finally by a sterile filtration, and the drug substance is ready. At that stage, the product goes through multiple steps of purification, and as well as testing, more than 35 of them. The slide that you see on the screen now is actually drug product manufacturing. That means the drug substance is the purified material is blended with adjuvants, different preservatives and everything, and finally filled into the vial. The last product that you see in the end of the final product is actually the product that is filled, and again it goes through multiple steps of in-process quality test and final QC release testing. Next slide, please. This is the specification of the product. It's a live, it's a inactivated vaccine, adjuvanted, liquid preparations, and to be given intramuscular. And I have given a specification of the details, which is actually will be available in the pack insert. And it's actually containing 25 IU of the inactivated virus antigen. And this is a dose which is 1 ml to be given to adults and 0.5 ml dose to be given for children. And the specific age groups, and this is a product like any other vaccines to be stored under cold chain conditions. The next slide, please. Now the question is why it was so challenging. Dr. Anand briefly touched that there are vaccines we are importing from China. There are international manufacturers who are selling the vaccines in India. Why it took so difficult, why it was so difficult to make a indigenously developed vaccine that IAL went through our R&D program. The toughness part of it is balancing the cost economics. This is a vaccine where the productivity titers are much lower. That means if we need to make it affordable, it requires tremendous amount of upstream work and optimizing the virus to grow to a certain conditions so that the final amount of yield that we received is good enough to make the vaccine affordable. The other thing I mentioned here is the purity. The stringency requirement of this vaccine in terms of its purity specifications, because this vaccine got launched or developed much later part rather than the days when DPT kind of vaccines were developed, the purity specifications are much more tighter. To achieve that level of purity, it requires a great deal of investigation into purification steps. If you go to the next slide, please. This is where I mentioned the endotoxin content specifications were very, very tight. It has to be less than 2 IU per single dose of human dose. And because the purity specifications are much tight, it requires a special kind of chromatography. Typically, if you understand chromatography, they are either based on size exclusion or charge or hydrophobicity. This is a chromatography that actually called multimodal chromatography that combine 2 different techniques and much more difficult to optimize when it comes to its purity specifications. And this is why, as I said, it was far more challenging to develop the vaccine preparation that we are launching today. With years of R&D efforts, we have overcome all those challenges, and finally the product is available right in front of you. Next slide, please. And I just want to touch that this product has gone through extensive human clinical evaluation. Next slide, please. This is a study. All the clinical evaluation that we carried out were actually published internationally in very reputed journals. This is a publication that actually appeared in Journal of Vaccines for the phase 1 studies. The next one mentions about the phase 2, phase 3 studies, which is also recently published in last year, late last year in 2023. If you go to the next slide, I won't go into the details, but fundamentally it was a comparative evaluation of non-inferiority with an existing vaccine from GSK, which is called Havisure. So if you go to the next slide, this is a high-level summary of the comparative assessment which was been done. I have captured the summary at the top, which basically clearly mentions the vaccine that we produced is in comparison to Havisure is non-inferior. That means both vaccines are absolutely equal when it comes to protection. There are two things which I've highlighted in the table, which is actually taken out from the peer-reviewed publication that appeared in Vaccine. The things that is mentioned in red that talks about 100% seroconversion and seroprotection, both the cases of the vaccines that was evaluated. That clearly signifies the clinical efficacy that we could able to achieve in comparison to its comparator. So that's briefly talk about the clinical side. If you go to the next slide, what basically I want to summarize, three things that we want to emphasize. This vaccine is a testament of IAL's commitment to its indigenous vaccine development. It is a cornerstone of IAL's resilience and innovation power. Several manufacturers in India tried to deal with the vaccine. Somewhere or the other dropped the project, could not able to succeed. We continued developing the vaccine, and that's why indigenous vaccine today is right in front of you. The last step that I mentioned here, it is a step towards carving a space into adolescent vaccines and adult vaccines. IAL has been historically very strong in pediatric space, hexavalent or DPT and tetanus. Now, hepatitis A, though equally important for pediatric cases or adolescent cases, also equally important for adult vaccinations. It is also being very strongly explored as a traveler's vaccine. So this is a step for IAL to diversify and to get into adolescent vaccinations as well as adult immunization programs. Thank you very much. Thank you for your attention, and thank you for listening to me. Thank you.
Thank you so much, sir, for giving a glimpse of the innovation in vaccine development. It is really interesting. Now, it's the moment to unveil a promise of protection. I request our Managing Director, Dr. K. Anand Kumar, sir, to please be on the stage. I request sir to please kindly be on the stage. I request our chief guest, Mr. Nagaraj Karpan, Shri Ajay Mishra, IAS Chairman, Indian Red Cross Society, Telangana, Deputy Managing Director, Dr. Priyabrata Patnaik, Dr. Raghvendra Babu, Dr. Ashish Chauhan, Senior Vice President, Manufacturing, Mr. Mukul Gaur, and Vice President, Human Health Business, Mr. Shakul Srivastava, to kindly join the stage for unveiling of the packs. I request our chief guest, Shri Nagaraj Karpan, MLA Telangana, to kindly be on the stage, sir. I also request Vice President Human Health Business, Mr. Shakul Srivastava, to kindly join us on the stage. I request Mr. Vishwanath Reddy to kindly hand over the bouquet.
Good evening all, and respected and dignitaries all the dais. It is very proud moment, and I will congratulate Dr. Anand and his team, because it is a big achievement for our India, Make in India. And also, there is a says that boss and leader, there is a difference. Boss is always sitting in the office. Leader is involving all the team members, and he is a good leader for this company. So it will go and serve the people, poor people who are affecting for nearly, just now I discussed with the Dr. Ashish, nearly 10 lakhs people who are suffering with this hepatitis. And I am also suffered in the young age. When I was in the department, you know, that's a training called as a jungle movement. So when we went to the forest, we taken the contaminated water, and I drink the water, and I suffered with the hepatitis B. So it is a proud moment for you and your people. Once again, I will congratulate all the bottom of my heart. Thank you. Good day.
I also request Shri Ajay Mishra, IAS Chairman, Indian Red Cross Society, and Mr. Shakul Srivastava to kindly be on the stage.
Friends, first of all, I'd like to thank the organizers, IIL, for inviting me and making me a part of this momentous occasion. It looks one achievement, but I think Dr. Patnaik, he made a presentation. The effort which goes behind developing a vaccine, and that to indigenous, is huge. It is to be appreciated by all of us, and not only because they have developed, because the benefit comes to all of us. All of us means our society, our country, and beyond country also, because IIL, as mentioned, exports the vaccines to more than 50 countries. I had heard the name of IIL earlier as a leading institute in research development of vaccines, but today I was much more enlightened, and I was informed much. Today I stand much better informed about the activities and the effort which goes on there. And I join all of you in congratulating IIL for this achievement. I'll call it, this is like they are repeating, they are creating history, and I'm confident that they'll continue to create history by developing more vaccines and products in the days to come. Thank you.
Thank you very much, Sri Ajay Mishra sir, for your compliments and motivating words. It means a lot to a company who is stepping into all India's first and making the country proud. So, distinguished guests, as you know, hepatitis A is a highly contagious liver infection that poses a significant public health challenge. So, moving ahead with the scientific sessions on viral hepatitis, its clinical manifestation, it's my honor to invite Dr. Y. Ramireddy, Senior Consultant, Gastroenterology, Star Hospital, to enlighten us on viral hepatitis. Dr. Y. Ramireddy, sir, please.
Good afternoon all. I am going to explain briefly about what is the exact presentation of hepatitis A virus and how we diagnose. Treatment part. Is this? Yeah, basically, this virus belongs to the Picornaviridae family, and initially the based on clinical manifestations, two forms of hepatitis were diagnosed in 1940s, but this isolation and attribution of these certain symptoms to this virus happened in 1973. And if you come to the how it comes to in the one's human body, is a main route is a fecal-oral transmission. That you should understand. The virus contaminating surface or blood or any food items that comes to the person's mouth, that is the main transmission. Most commonly fecal matter contaminated, fecal matter containing the virus contaminating the food items or liquids, whatever. Then is a most common transmission. If any person consumes that food item contaminated with virus, that is a major mode of transmission, even though others are there. If you consider other modes, particularly when viremia is there, if that viremia means whenever in the one of the phase, in pathogenic phase, virus comes into the blood. Suppose if any person transfused with that infected blood, they can get this virus. And again, sexual transmission, particularly anal sex or fecal-oral sex. In that case also they can get. And other means is contamination with food items. Those are the various modes of transmission. See, the outbreaks are known across the world, and particularly because this fecal-oral contamination, whenever it is contaminated water is distributed across the community outbreaks and outbreaks among the healthcare settings are the known thing. And sometimes they can happen in the sporadical also. Most of the time what we see is the sporadical cases, and at times because of the water contamination also, will give a lot of cases because of the community outbreaks. Then if you consider the pathology and the virus enters into, these are the hepatotropic virus. This virus enters into the liver cells through the receptor. Within the liver cells, it replicates and multiple viruses will come. And mainly during that phase, our body responds to that virus to clear that virus off by the T cell response. And in that scenario, it produces the liver damage. And if in case of the liver damage, patient get symptoms. Particularly, these patients are immediately after infection, they won't get any symptoms. There will be incubation period of average around 4 weeks, and but it can go up to 50 days also. And once the infection starts, then mainly they come to the physician with a fever, malaise, jaundice, and these are the main symptoms. Once once the disease advances, and they can come with pruritus and other symptoms also. If you consider nausea, vomiting, anorexia, fever, malaise, these are all are the non-specific symptoms also. But when sometimes with these symptoms, when we evaluate them by once patient, excuse me. Whenever they get infected, most of the patients, it depends on clinical manifestations, depends on the age group. Suppose in pediatric population, in more than 70% of the patients are asymptomatic. Unlike adults, in the more than 70% of patients are symptomatic. Those who are, once they get infected, 99% of the cases they recover spontaneously because of the self-limited illness. In 1% of the cases, they can go severe and fulminant hepatic failure also. In such cases, at 1/3 of the cases, they may require liver transplantation. Apart from the liver manifestation like jaundice, and they have some extra hepatic manifestations also, and that I'll explain in the coming slides. Here you can see this diagram. This before onset of the symptoms, the fecal shedding of the RNA will be more, and the serum RNA also more. Once symptoms onsets, the liver damage, liver enzyme elevation, and we'll see. And initially, subsequently, we see the IgM antibodies followed by IgAV. As I mentioned, most of the clinical code self-limited, and most of the patients, even if it is a chronic relapsing illness also, they settle down in the 6 months duration. But unlike in very few cases, chronicity is not known with this hepatitis A virus. And coming to the laboratory abnormalities, what we commonly observed is initially to elevated liver enzymes into multiple folds, and subsequently the elevation of the bilirubin is noted. And that is these are the mainly two symptoms. Apart from this, inflammatory markers are elevated. And in case of fulminant failure, we diagnose when there is associated encephalopathy and coagulopathy, means INR more than 1.5. Combination of these symptoms we diagnose as a fulminant hepatic failure. And as I mentioned, not only the liver manifestations like jaundice, some of them are having the skin rash and joint pains, and a few patients will be having symptoms like they can not only the liver, they can affect other systems like blood, neurological systems, and cardiac. They can produce myocarditis, vasculitis, and arthritis, glomerulonephritis, and hematological manifestations like aplastic anemia, red cell aplasia also they can produce. They can produce skin manifestations like toxic epidermonecrolysis. And coming to the complications, as I mentioned, it is a mostly self-limited acute episode, but few patients it can go to chronic phase. They can produce cholestatic hepatitis, and there can be relapses which can be multiple, and sometimes it can trigger the autoimmune hepatitis also. If cholestatic hepatitis, mainly they present with persistent jaundice along with pruritus, and laboratory abnormalities will be the elevated jaundice. And at the same time, in such scenario, we commonly do ultrasound abdomen to rule out any other causes of cholestasis. That is one thing. But most of these patients settles down, and the symptoms duration will be more than 3 months, and they'll settle down within the next 3 months. Coming to the relapsing hepatitis, it can happen up to 10% of the patients, and they respond within the 6 months, they'll get a relapse of these symptoms. Most of the time, these relapses will be less severe, less clinical severity when compared to the original episode, and the laboratory values also and the less abnormal when compared to the initial episode. And in these relapses, some of them, around 10 to 13% of the patients can get multiple relapses. And as I mentioned, the autoimmune hepatitis can be triggered, means our liver, our body generates antibody which acts against the hepatic cells, which can induce the autoimmunity, and which can be the chronic problem. We diagnose this by presence of antibodies and taking biopsy from the liver. Coming to the diagnosis, mainly whenever the clinical symptoms and are the very non-specific, and mostly we diagnose, for the confirmation of the diagnosis, we depend on the liver LFTs and imaging studies. And in liver enzymes, mostly they are very SCOT and SGPT are the much more, and PT will be more than the OT, and bilirubin elevation can we see in the later weeks. And coming to the antibodies, IgM antibody is particularly in acute phase. By the time they are symptomatic, this IgM is positive, and we diagnose with that. And in case of the chronicity, IgG antibody will noted. Those will be protected. The lifelong immunity these are the protective immunity, lifelong protective immunity. And imaging studies mainly not indicated, but sometimes generally we do imaging studies to rule out other causes. And in such cases, in case of the acute episode, we can see the edema of the gallbladder, and in CT, we can see the periportal coughing, we can see. These are the common thing. Mainly it is helpful in to rule out other causes. And as any infection, we notice the lymph nodal enlargement. In acute viral hepatitis also, we can see the periportal and abdominal lymph nodal enlargement. Whenever this acute phase with elevated liver enzymes and jaundice, whenever they present, we have to consider, particularly in the clinical diagnosis, we have to exclude and we have to consider other hepatotropic viruses also. Like that's why we do the minimum markers for the hepatitis B, C, D, E, and similar picture can be presented by even though it's rare, by other viruses like HSV, Epstein-Barr virus, and adenovirus, and HIV. And if you not only these infective causes, we should consider other possibilities like more common like malaria and leptospirosis, and non-infectious causes like alcohol hepatitis and drug-induced liver injury. Prevention, mainly taking safe drinking water and proper disposal of sewage within community, and the personal hygiene practice is helpful in the prevention apart from vaccination. These are the various vaccines till now existed. With this availability of the current introduced vaccine, we will be having one more to this. Generally, we will give one dose. Booster dose will be repeated, ranging from 6 to 18 months. In case of the prophylaxis, we can use immunoglobulin also, dependingly, particularly those coming from non-endemic areas to coming to endemic areas, we can take the immunoglobulins also. And take home message, it is mainly humans are the sole reservoir for this virus. It is more than 99%, it is a self-limited illness. In 1% of the cases, it can cause acute liver failure, and in such cases, liver transplantation can be considered up to 1/3 of the cases. And it can be prevented by following the proper vaccination and proper safety precautions. That's. Thank you.
Thank you very much, Dr. Rami Reddy, sir, taking us through the clinical manifestation of the highly contagious hepatitis A virus. Now, it's my request for Dr. G. Srinivas Reddy, consultant, clinical and transplant hepatology, Star Hospital, to discuss on the management of hepatitis A virus. Dr. G. Srinivas Reddy, sir, welcome, please.
Good afternoon, respected dignitaries, and thank you for giving this opportunity from Star Hospital, Gopichand sir, and my liver transplant team, Dr. Raghavendra Babu, and my senior professor, Dr. Y. Ram Reddy. And today we are just discussing about management and prevention of hepatitis A. We all know that somebody got some hepatitis A viruses. everybody think that, okay, it is hepatitis virus only, don't go to hospital, just keep it in home, take some water and rest, or go to some RMP hospital, or taking some Ayurvedic medicines. So when and how to react patients with hepatitis A virus hepatitis A virus infection, that we'll discuss. So we all know, please listen that viral hepatitis, there is hepatotropic viruses. That means viruses which is involving liver. That is hepatitis A, B, C, D, everybody knows. But some of the viruses which are non-hepatotropic viruses like dengue and Epstein-Barr viruses, herpes simplex viruses, all these things can cause liver in later stages. It is not like somebody has jaundice, it is like just viral. We need to think other causes also. So as Sir has discussed, pre-vaccine vera, where people, most of them, child usually get hepatitis A virus vaccine, hepatitis A virus infection predominantly up to 80 to 90%. So once we got vaccine era, if you see here, the incidence of child getting infection has come down, and who is getting, adults are getting infection. How to go about is this, and we need to give vaccination properly. So in our Indian studies, where you can see here, the sero prevalence is usually around 56 to 60%. So we need to get 100%. How to get it? By giving some vaccination. So if you see here, this is the reason. In Delhi, we have done some study which was showed the sero prevalence is 36.7%. That means there is a 66% they have not even vaccinated. And what to do? Why? They might get infection. They may go into worst phase also. So these are the HIV outbreaks in India. If you see all over the world, if you see in India, in Lucknow, 267 cases, FICO oral route, and in Mylapore village, India, 45 cases, where these are the two endemics are there, where got severe infection, viral hepatitis, but 2% got ALF, acute liver failure, 98% are recovered. But please remember that there are some outbreaks will be there. It's not like don't neglect about hepatitis A virus infection. So how to go for management? So please see carefully. Acute viral hepatitis, it will present like differently. So it will present with just fever, jaundice, malaise, or it can be prolonged cholestasis. Some people may keep on itching, keep on getting itching, vomiting. That is called as viral hepatitis with prolonged cholestasis. And atypical presentations, that sometimes these patients may get anemia and renal failure also. And this is called as acute liver failure, complete liver failure. They will have jaundice and they will go into the coma. This is seen in 2 to 3%. And some of them are acute and chronic liver failure. Somebody has underlying cirrhosis or somebody has underlying liver disease. Who got infection? Suddenly they will decompensate. Suddenly they will get jaundice, ascites, everything. So please listen that everybody who are not screened for liver problems till now, please come to our Star Hospital. Please screen for liver diseases, whether you have or not. Please get liver screening, everything. So whether you have liver disease or not, we will see. If no liver disease, yes. If liver disease is there, we need to go ahead. It is not like only viral hepatitis. There are a lot of liver diseases are there. Fatty liver, hepatitis B, hepatitis C, everything. So many patients with viral hepatitis, if you do ultrasound, they will have just gallbladder edema only. Other than that, nothing we will get. So this is a study where, if you see this study, out of 47 patients with viral hepatitis A, they will have 4%. That means 4 cases got fulminant hepatitis. That means don't neglect, don't relax. Somebody has some infection, please come and visit, take doctor's opinion. It is not like everything. We used to read the books like, okay, hepatitis A virus is self-limiting. But please care that 4%, they will go into the fulminant hepatic failure. Please call, please come to the hospital, take advice. Then you can go to hospital or you can keep in home and you will be in good touch with the doctor. When there is a problem with something, we can come to easily to the doctor. So these are very important. Presence of encephalopathy, presence of coma, or presence of bilirubin more than 9.6, or creatinine is 2 milligram per deciliter. That means this patient may go into severe condition. Please take this picture and show to everybody they have some problem. Okay. So I told if the patient has viral hepatitis on underlying some liver diseases. See, if you see here, the out of ACLF means who has underlying liver disease, got some infection. Out of 3,220 patients, 121 had viral diseases and they have decompensated, and 36% of people have died without, there is no treatment. Usually they have no donor for liver transplant, they have died. So please listen carefully, that very important, that every patient with hepatitis A, don't neglect. So as I told you, fulminant hepatitis means 4% they will have fulminant. If you see here, 29 patients, out of that 50 to 60%, as I told, they have spontaneous recovery. That is called as hyperacute liver failure. They will have recovery. Who has not recovered? If you see, 9 underwent transplant, that means 31% they underwent transplant. So it is not easy that hepatitis A, easily it will cured by medical management. They will have chances to go for liver transplant also. So please educate everything in your family members, in your villages, in your cities, that don't neglect. So if you see whatever I told previously, there are spectrum of diseases how to manage. If they have some prodromal symptoms, just mild jaundice, we can do support to management by giving hydrations or giving some antioxidants. But if you have prolonged cholestasis, that means underlying itching is there, they will have high bile acids. So we need to remove this all bile acids by doing plasma exchange. That means we have some filter, we can remove all these bile acids and all this bilirubin, they make better. And acute liver failure, they have to undergo liver transplant. There are certain conditions according to the criteria. My Sari will speak on that. And ACLF, and it was liver transplant only, because 38% mortality. So as I told, medical management support you. Only thing is self-limiting 50 to 60%. Diet, rest, get adequate food, adequate liquids, and avoid alcohol. Don't use any medicines from any other doctor. Just meet hepatologist, liver doctor. He will give some medicines. He will take care. It's not like don't go to some RMP, don't go to some Ayurvedic medicine. Something you take, the liver failure will worsen. So some of the patients who has came with acute viral hepatitis with prolonged cholestasis, that means bilirubin is more than 30, 40, prolonged itching. So we have done, there have some plasmapheresis where we can remove all these bile acids, plasmapheresis. They have survived. Out of these are the studies where some of them has underwent plasmapheresis, plasma filters, they have survived. So as I told you, acute liver failure, that is the definition, jaundice followed by encephalopathy within 4 weeks. That is, they needs liver transplant if INR is high. So as I told you, acute liver injury, that means they will have injury. If acute liver failure, they have injury and they will go into the coma. So that is called as ALF. Please remember that if any patient who is not talking properly, not identifying their mother, father, not talking irrelevantly, please come immediately to our center. So this is the ALF various with geography. In our India, hepatitis E and A is 44% predominantly. And fulminant hepatitis is 4 to 6%. Keep in mind that this is very important. So suppose if the patient came with ALF patient to our ICU, what should we do? We need to do regular, assess the disease severity, PTINR, that means how much blood clotting factor, whether it is a thick or thin. That is an important prognosticate marker in ALF. And we need to do all viral screening, hepatitis B, hepatitis C, A and E, they will have coexisting infections. So these are the one study where patients have ACLF, that means ALF, acute liver failure, because of hepatitis A. Out of 182 patients, 6 patients have hepatitis A virus who underwent plasma exchange. 3 patients have survived, 3 patients has died because they have no donor in our family. So please remember that hepatitis A is still there is an indication for liver transplant if the criteria meets. So how to prevent? As I told, vaccination, immunoglobulins, and attend proper hygiene methods. So indications for vaccination, these are the children from above 1 year. So previously also we have seen more than 1 year. So some people may got doubt, why less than 1 year, why will not give? So usually less than 1 year babies, they will have auto antibodies which was transferred from mother to baby. So need not to worry till 1 year. So after 1 year, they might lose these antibodies. So we need to vaccinate them. So individuals at risk who was going towards high endemic cities like Lucknow or some places where hepatitis A virus is predominantly, those needs vaccination. And severe diseases, somebody has chronic lung disease, somebody has liver disease, somebody has some vascular diseases, they should get vaccination to prevent further damage to the liver and further damage other organs. Please remember that if anybody has underlying some disease, better to vaccinate what not only hepatitis A, every vaccination according to schedule. So passive immunization means like immunoglobulins. We can give who travels endemic city or age more than 40 years or kids less than 6 months. As I told, not required for vaccination, but still somebody may got high endemic city who are kids are going. Those kids, we can give immunoglobulins like antibodies like passive immunization. They can protect from that. So these are the hepatitis A vaccine schedule as previously discussed. It is at 2 doses, 0, and after that 6 to 12 months to boost. Every vaccination has 90 to 95% efficacy. Even somebody has missed first dose, second dose, nothing to worry. They have 100%, 95 to 100% they have immunity also. So hepatitis A virus, Harix and Vapta, now in India we have vaccine is there, third it is added. So whatever I told till now is any patients who are immunocompromised or chronic liver diseases or something, we need to give at least 2 doses. And if you are traveling to endemic city, at least you give some immunoglobulins also. So take home message is don't think hepatitis A virus is self-limiting. Don't think. They might get some infection that we don't know who will go sick. And promptly meet hepatologist who is taking care of liver. And no CAM and no Ayurvedic medicine. Don't take any Ayurvedic medicines or don't take anything. Please meet us and tell us how to guide. Approach to treatment according to the presentation. If it is initial presentation, wait and watch. If he has some cholestasis, we can do something. If he is going to coma, yes, we need to list for liver transplant. Please remember that. And thank you for giving this opportunity once again from Star Hospital and my liver transplant team, Dr. Raghavendra Babu sir is there. And from Indian Immunological Studies, thank you sir for giving this opportunity.
Thank you, Dr. Srinivas Reddy sir, for taking us through the management of hepatitis B virus and the prevention, and all the more important, the vaccination part. So we're now privileged to listen to Dr. Raghavendra Babu, Chief of Liver Transplant Department and Hepatobiliary Surgeon, Star Hospital, on liver transplant in hepatitis A virus-related acute liver failure. Welcome, sir.
First, we congratulate Human Biological Institute, which is a division of IL. And I also congratulate Dr. Anand and Dr. Priyabharatam for giving us this opportunity to talk about HIV and its manifestations. I'll briefly be touching on the serious manifestation of HIV, hepatitis A virus, that is acute liver failure, or which is also called as fulminant hepatic failure. Next slide, please. Yeah. Oh, sorry. I think it's not working. Yeah, first slide, please. No, not this one. The next talk. Where is Mr. Santosh? Uh, Mr. Santosh, hope you have received my presentation. Yeah, yeah. So meanwhile, I'll just discuss about the serious manifestation of hepatitis A virus. So far, my colleagues, Dr. Ram Reddy and Dr. Srinivas Reddy discussed about the clinical manifestations and mild to moderate disease, and Dr. Srinivas Reddy also has briefly discussed about the serious manifestation, that is acute liver failure. So what would be the medical management and when we are supposed to do liver transplantation? So myself as a liver transplant surgeon, probably I will be touching only when a patient need liver transplantation. As our previous speakers discussed about the medical management, which is basically a supportive treatment. The most important thing so far, the reason we are all assembled here is prevention. So that's how the company has come up with a nice vaccine, which is innovative and make in India. First of all, we should congratulate. And next slide. As I said, is the most dangerous manifestation of hepatitis A virus. Almost up to 95% or 96%, the manifestation is either asymptomatic or mild to moderate disease. So, which can be treated with supportive care. And majority of these patients, they are asymptomatic, as I said, and some patients they need hospitalization, and very few patients they need ICU admission. But when it manifests as like acute liver failure or fulminant hepatic failure, these patients they need to be monitored carefully in dedicated liver unit, and we need to counsel the family, and when we diagnose or when we define it as acute liver failure for potential liver transplantation also. So there will be a very high mortality when it manifests as acute liver failure, especially in the absence of dedicated liver unit, or when there is no specific treatment, or like hepatitis A virus, there is no specific treatment. All we can do is we can give is supportive treatment or organ supportive care. And if liver transplant is needed, and if liver transplantation is not possible for some reason, and those patients they are going to die. Next slide. So what is the definition of acute liver failure? The more widely accepted definition as by American Association of Study of Liver Diseases is when there is coagulopathy, especially when INR is more than 1.5 and there is associated hepatic encephalopathy, that is altered sensorium, then we can define it as acute liver failure. So, yeah. So what are the etiologies of acute liver failure? We are all sitting here to discuss about hepatitis A virus and its prevention. So apart from viral hepatitis, the most common cause for acute liver failure in India is hepatitis E virus and hepatitis B virus. Hepatitis E virus, we all know. Regarding hepatitis B virus, it's basically it's sudden manifestation of hepatitis B virus when there is some kind of immunosuppression or some reactivation. When it comes to hepatitis A virus, though it is less common cause of acute liver failure amongst viral hepatitis, but also it can also manifest as serious disorder. So, drug-induced acute liver failure is most common in Western countries, and ischemia and other rare causes are also there for acute liver failure. What is acute liver failure? Spontaneous recovery is expected in up to 70 to 80%, especially when it is not fatal. So, all the hepatologists or the transplant surgeons, they initially give supportive care, medical management, and they try to assess will there be any spontaneous recovery. But at the same time, they also counsel the family for the need of liver transplantation. But how spontaneous recovery happens? So, as our speaker said, even if it is a mild disease or even if it is a serious manifestation of acute liver failure, still there is a possibility of spontaneous recovery. That is because of the enormous regenerative capacity of the liver. So the problem is how to assess how to predict the spontaneous recovery or how to predict the mortality is a difficult thing. So that's the reason we need to manage these patients in dedicated liver units and closely monitor the patients. Next slide. This is the when it comes to Western countries, we can see the most common etiology of acute liver failure is drug induced. But when it comes to Asian countries, the most common cause of acute liver failure is either viral hepatitis or some unknown reasons. In India, the common HIV induced acute liver failure is up to 4%, and hepatitis B related acute liver failure is up to 12%, and the most common cause of acute liver failure in India is hepatitis E virus. Next slide. So this is a study taken from BMJ publication. You can see notably the difference between countries who routinely vaccinate and who routinely do not vaccinate. The prevalence of hepatitis A virus in countries where there is no policy of routine vaccination, there is a huge difference between countries who routinely vaccinate and who do not routinely vaccinate. Next slide. So less than 1% of patients, they manifest as acute liver failure. Sometimes the series is like 2 to 3% also. Infection is more severe in adults, especially when there are associated immunocompromised state or some other chronic illnesses. And the symptoms are there in almost like up to 70%. As I said, spontaneous recovery rate is up to 69%, but some studies quoted up to 90% also. The remaining 10 to 31% of the patients, they need emergency liver transplantation. If the patients meet the criteria of liver transplantation and they don't get liver transplantation for some reason, the mortality will be very high. So patients with pre-existing non-alcoholic fatty liver disease or alcoholic steatohepatitis or some other chronic illness, there is a tendency to progress into like acute and chronic liver failure also. Next slide. So vaccine preventable viruses causing acute liver failure or needing liver transplantation, as we discussed, is hepatitis B virus and hepatitis A virus. We know that there is a nice vaccine for hepatitis B virus. We need vaccine for hepatitis A virus. Next slide. So these are all the scoring systems to prognosticate acute liver failure due to hepatitis A virus or some other viruses illnesses also. Most commonly followed is King's College criteria. Depending upon the jaundice to encephalopathy interval, we can label it as hyperacute or acute or subacute. Next slide. So these are the prognostic scores. Most commonly followed is the King's College criteria. Next slide. So this is the explant liver pathology of a patient who had acute liver failure and subsequently underwent liver transplantation. We can see massive hepatocyte necrosis with predominant lymphoplasmacytic infiltration also. Next slide. So this is how we manage a patient of acute liver failure due to hepatitis A virus. Irrespective of etiology of acute liver failure, first we admit them in intensive care unit. Broadly, we manage with medical management giving organ supportive care, and if there is no response or if the patient is taking time for liver transplantation with supports like plasmapheresis or if needed dialysis, we support them, and eventually if they need liver transplantation, then we need to organize liver transplantation. Next slide. So these are the liver transplantation. In India, we are depending on living donor liver transplantation that can be conventional or auxiliary transplant, or otherwise in Western countries where organ scarcity is not there, they organize deceased donor liver transplantation also. Next slide. So to conclude, although rare, HIV manifesting as acute liver failure is routinely seen in liver units, and early recognition of ALF and urgent referral to a transplant center offers timely access to liver transplantation, And overall, the post-transplantation 1 year survival rate is very good. It's almost like 1 year survival is almost like 85% and is as good as like liver transplantation performed for other etiologies. So vaccination is recommended for high risk group and also for endemic countries. Thank you.
A sincere thank you to Dr. Raghavendra Babu sir for taking us through the importance of acute liver failure and especially hepatitis A related acute liver failure and the importance of vaccination. It has certainly created awareness and seriousness about this contagious virus. So distinguished delegates, as by now we all know that this hepatitis is contagious. Both adult and pediatric population gets affected by this virus. Today, we have the privilege of listening to Dr. Ashish Chauhan, consultant physician and diabetologist, Apollo Hospital, Secunderabad, on adult immunization updates and recommendations. I am pleased to invite you, Dr. Chauhan, for the next scientific session. Welcome, sir.
A very good evening to one and all. It's absolutely delighted to be here. And Anand Sahab, I must start with the words. I really loved the way you went ahead and told us, ज़िंदगी में पहला कदम लेना बहुत ज़रूरी है, बस वो कदम सही होना चाहिए. When sir said that, you know, first the need of the vaccination for FMD disease, because sir, whether it's a Dr. Ashish Chauhan you are seeing or not, you must see a father standing here. We all are parents out here. With all the Facebook, WhatsApp generation, we are scared parents because we do not know where our generation is heading towards. अभी भी हमारा दिल धड़कता है, हमारा बच्चा इस समय क्या कर रहा है? Is he in the dark web or where is he? The promise has to be made to our new generation. That is very important. The last word which was talked by the liver transplant surgeon is everybody in the endemic country should take the vaccine. My dear friends, India is the endemic country. 3 big endemic countries, highest number of hepatitis A. Right now you can search the Google, I have done it 3 minutes back. The top 3 countries are India, Nepal and Bangladesh. I'm forced to take up internal medicine because India never gave importance to community medicine and psychiatry. I always wanted to be a community medicine and psychiatry guy. And then I realized, okay, internal medicine is the best way to do it. Today I'm here to talk to you about your health, my dear doctors. There are stupid professionals who live 10 years lesser than the average life expectancy. I'm very uncomfortable to say that, but that's a fact. Kerala has got the highest life expectancy, 75. There also doctors live 10 years lesser. These are the facts, study done by IMA. My dear doctor friends, this discussion of mine is about you and you only. आपको एक बात हर समय याद रहेगी. When you are in the plane, definitely not in Indigo, we all want to avoid it. But when you're in the plane, you remember one thing. When there is some decompression, put the mask first on your son and then to yourself, right? Or is it the other way around? It's the other way around. First put the mask to yourself first. Dear fathers and the parents who are sitting out here, vaccinate yourself first. You do not even know what it feels like to be the fatherless kid. And your kid will be, because yes, few days back we've had from Ahmedabad, Gujarat, 41 years old cardiologist died of heart attack. Doctors are in the fastest journey to move either towards heaven or hell. And this discussion is about you. I would switch over to my big discussion on adult vaccination. There are lots, but take my words, this discussion is about you. Okay, the slides do not. Can somebody change the slides? These are things we'll discuss. And you need to see these slides because these slides are for you. You need to read through these because these are about your parents, if they're alive. Mine are not. And then I realized there is a responsibility which we handle. Immunity and types, adult immunization, practice standards, methods, and adult vaccination in India. Next, please. Burden of disease. The slides are many. I'm not going to go through each and every line. But yes, I've been working in Yashoda, and then I moved to Apollo more than 10 years. The only job which I do there is how can I keep a hospital empty? I boldly say that. That's a responsibility, Sahab. Before you, the gentleman who came, the MLA Sahab, he was a police officer. The best police in India is Hyderabad, Telangana, best medical system is in Hyderabad. And I'm very proud. And why they are the best? Because they believe in prevention. Indians have to believe, Telangana people have to take stride to the next level by promoting prevention. Numbers are staggering. We do not need to go. We all have a Google, we can check it out. But yes, prevention is the way of life because you yourself cannot afford and will not like getting admitted. Next, please. Adult vaccination coverage is 45% for everything. Even internationally also the vaccination have been horribly less. The only reason? Any idea what is the reason why vaccination is less? So media is only interested in diseases, not in prevention. Preventing hepatitis A, 2,000, 5,000 rupees. Treating hepatitis A, liver transplant, 35 lakhs. Isn't it? And that's where you and me need to understand it. And take my words, I'm not happy to say, doctors can't afford it. I'm an Apollo consultant, I feel very happy, and I know majority of doctors can't afford it. Watch out. 5,000 rupees of injection doesn't matter anything. Shingles has come with 10,000 rupees. Prevention is a million times better than cure. The Holy Bible of internal medicine is Harrison. And as per the CDC and WHO, the two statements which are kept, the only two things needed to keep people out of hospital, providence of clean water and the vaccination. Today, I urge you all to take vaccination which you are meant to be taking it. Flu definitely, pneumococcal definitely, and yes, hepatitis A definitely. 6 weeks to 6 months I have seen people out of work. It's one of the horrible disease which you are incapacitated to go for your work. Next, please. Hepatitis B vaccination. The number one vaccine to prevent cancer is hepatitis B. And the prize will go to the one who will tell me the second vaccine which prevent cancer is. Come on, guys. Which vaccine prevents the cancer? HPV. It's important to say it out because January is the cervical cancer awareness month. If you love your daughter, get her vaccinated by the time she achieves menarche. 200 ladies die with cervical cancer every day. Or should I say every hour? I'm confused. But then the number is huge. Second highest killer of ladies being the cancer after breast. Next, please. These are the various practices which we need to understand. Next, please. Adult immunization, which we need to understand. And how do we understand that? Next, please. Assessment and strongly recommend. This word strongly recommendation is very important. साहब वैक्सीनेशन क्यों नहीं? दो चीज़ें हैं which are killing Indians, which are horribly being not done by the doctors. We don't talk about vaccination, we don't talk about insurance. We talk about insurance the time patient is in ER and then they start saying, yaar ye commercial doctor hai. When he was coming to OPD, we never talked to him about insurance. Sir, I come from Christian Medical College, Vellore, very, very proud to be a product from that college. दो चीज़ें वहाँ पे कभी नहीं सिखाई गई, which now I realize are the most important for a good practitioner, art of communication and art of business skills. We don't learn it, so MBAs rule. And then they make the policies which we do not agree to. You have to learn 4 I's if you want to save yourself, if you want to save India. Number 1 I is information. Please get the right information, share the right information. Number 2 I is insurance. Talk to your patient about insurance. Get yourself insured first. At least 50 lakhs, not less than that. Third I is investigation. People accuse us that we write too many investigations, commercial doctor. But patients die because of less investigation, sahab. We all know it. And the final I is immunization. Insurance, information, immunization, and investigation is the key thing. Let's start talking about it before it is too late. Next, please. Question. What could you practice to do to raise vaccination rates among your patients? What can you do? Give it to them before it is too late. I give it to every patient who comes to me for the treatment. No, I do not give it because they're already sick. Khasi se aaya hai, you don't give them the vaccination. I give it to their relatives then and there. Please talk to the relatives about the vaccination. Please talk to the relatives about the insurance. They understand it. Next, please. The successful vaccination programs, this has been given by various guidelines, is patient education. Educate, agitate, and organize. Ambedkar Sahab. 12th fail nahi dekhi hai, then you're a bad parent, take my words. All of you should watch the movie 12th fail. I sincerely believe it should go for the Oscars. Next, please. Improving use of immunization information. Increase use important for many reasons. Right vaccine at the right time. Tracking vaccination rates, very, very important. Potential for use in quality measures and coverage tracking. In pediatric, whenever till now, who used to talk about vaccination? Only the pediatrician या community medicine. पीडिया बच्चों को तो हम ठोक ठोक के लगा देते हैं, अपने को नहीं लगाते हैं. And that is where we are wrong. This needs to be understood. Next, please. Place of vaccination for children. I love this slide. If we are lacking vaccination in India, we'll talk about India. See the statistics, the only place they can be vaccinated maximum is doctor's office. Even if I'm an Apollo and there is a vaccination nurse, I give vaccine myself. I say, Baba, lekar ke aa jao. Why do I do it? 3 reasons. Patient is happy. Number 2 is I know whether that vaccine is available or not available. Number 3 is I am 100% sure they have got it. I always do that. Other reasons, it doesn't work out. I still believe it. Doctor's office is good. It's good for your revenue generation also. In Apollo, it doesn't affect us. But if you have got your own practice, you know it. Blessedly, you can have the good revenue. Prevention not only saves patient, it gives you good revenue also. You just know how to give it. Treatment, you will give it to one patient. Right? See, the problem with pharmaceutical industries, they're all in rat race. Suddenly, everybody will start talking about statins. Then everybody will talk only about sitagliptin. Do you get the point? We all know it. Treatment is only one patient. Prevention is about 1,000 patients. Revenue generation, if you want to learn the business skills, one of the best revenue in doing the noble work is giving the vaccinations. Next, please. Immunoprophylaxis in immunotherapy. These are the various jargon, academic jargon. I wouldn't want to waste your time on it. Next, please. Next, please. Method of administration. These are oral vaccines. We all give it. We all know it very well. Still, when people go to Africa, they come to me to take the oral polio vaccine. I very happily do that. These vaccines are good. Even cholera vaccine is very, very good and should be taken for the ones who are going to such areas. Next, please. Intranasal route are coming up. Still, not everybody is very convinced about it. And there are very reasons about it. Next. Subcutaneous, intradermal, as well as IM is one thing which we stick to it. Take my words. Academically, you will go, it matters. Non-academically, it doesn't matter, sahab. Aapne vaccine de di, bande ne le li. I was very happy when Srinivas Reddy said, first dose will give you 95% protection. First is important. Anand sahab ne bhi first step liya tha, milk revolution mein. First step, aapko lena hai, aapko bachcho ko sikhana hai. What do I do today, every day morning, first step? Bachcho ko hug karke bolta hu, beta, I love you. I pray for them, 3 minutes. And my job as a father is over. First right step, we have to take it. Rest the journey and your creator will take care of it. So give vaccine. Rabies, the new technique, Padma Shri Dr. Omesh says that, we give it intradermal. Techniques can be different, which is fine, whichever you are convinced with, but that it has to be given is very important rather than the technique part of it. Next, please. Intramuscular, we all know it. Next. Intradermal also, this is what I was talking about it. Rabies prevention, we give intradermal nowadays on both the deltoids. Next, please. Live vaccines, we know it, there are few, oral and polio and others, and we avoid it in HIV or other cases. Otherwise, they are good. Next, please. Advantages, disadvantages, not needed. Next, please. Inactivated, a good number of vaccines are inactivated ones, we know it, and they are very, very meaningful. Next, please. Good and the bad. Next. Combination vaccines are a very good thing. I think this is what I would, from this platform, I will request IIL to consider a competition to Twinrix. I'm not sure whether it's available or not available. I really believe I would want something like Pentaxim and Hexacin if the hepatitis A can be combined with other vaccines so that we can decrease the injection. Next, please. These are the components which we put it in the vaccine to make it last longer, not needed for you and me at this time. Next, please. Can you just go a bit faster? Okay, this is what we need. We tell everybody, take my words, all of you, as well as all of your children, they need all these vaccines. And you know what? If you're not convinced, you will be convinced the time your child gets admitted into US university. In US university, you do not get entry without taking the vaccination schedule. I have been giving travel vaccination from last 20 years. I have everybody hunting the Just Dial and coming to me. Why? Because the normal doctors did not give it to them. Please store all the vaccines in your own refrigerator. I'm very much sure IIL will help you out. Give it by yourself. It's good for the patient. It's good for your business as well as practice. Next, please. DTaP, we give it 2 doses are there. Otherwise, a single dose once in 10 years is needed for all of us. Next, please. Pregnant women, only 2 vaccines we give, flu as well as DTaP. We don't give anything else. Doubt about COVID, I wouldn't want to talk about it, but yes, the established branch to be given for the pregnant women is flu and DTaP. Next, please. Next, please. MMR, one of the very, इस समय बात करना बहुत जरूरी साहब. Mumps के केस suddenly have gone up. Every 3rd, 4th day I am seeing one patient of mumps. What can it cause? I'm scared when it calls your balls to boil because yes, it causes orchitis, it causes pancreatitis. And yes, they are the painful condition. A vaccine could have saved them. Please give MMR vaccination. Last thing I would want to tell all of you, because I believe all of you think that you have taken MMR, you don't need it. Simple answer, right? 10 children who were going to United States, and there they take the titer values. I have done the MMR antibody titers. Out of 10, 9 did not have appropriate levels. Only 1 child had it. That's what is your and my status. जब भी कभी कोई पेशेंट आकर के बलान की इंजेक्शन कहता ना, ताकत का इंजेक्शन लगा दो, मैं धीमे से उसको हेपेटाइटिस बी ठोक देता हूँ. लिखता हूँ, मैं आई डू नॉट हाइड, आई डोंट चीट. से साहब देखिए, समझ की फेर होता है. यू मस्ट से बाबा आपकी इम्यूनिटी बढ़ाएगा, ताकत का इंजेक्शन है. से इट डिपेंड्स कि हाउ यू आर गिविंग इट. एंड आई राइट इट. आई एम नॉट हियर कि आई डू द चीटिंग. आई राइट इट कि भाई ताकत का इंजेक्शन है. You must know how to sell the right thing in the right way, nothing else. Next, please. Indicators of MMR, we all know it. Next, please. Chicken pox, again, इसके भी cases बहुत बढ़ रहे हैं. I just got a call from Lucknow, one of my friends got it. Ladies should take it because yes, pregnancy में problem होती है, तो before you get engaged in any of possibilities of pregnancy, take the chicken pox vaccine, 2 doses, we all know it. Next, please. Recommendation. Next, please. HPV, Cervical Cancer Awareness Month is what is January. For heaven's sake, talk about it. You know what is the tragedy? The tragedy is 80% of the time cancers diagnosed in India is in the last stage. And in US, 80% of the time, the cancer is diagnosed in the first stage. Let's be preventive and proactive, my dear friends. Next, please. First dose is most important in HPV. There were 3 doses, there were 2 doses. Take my words, I always wanted to say first dose अपने हाथों से लगा दीजिए. Second, third को हम लोग देखते रहेंगे. Next, please. Schedule 016, 026, HPV4 is recommended. This is important, साहब. This is very, very important. जहाँ HPV की बात आती है हम लोग कहते हैं लड़की को लगा दो, बहन को लगा दो. लड़कों की ज़रूरत नहीं है, बहुत ज़्यादा ज़रूरत है. It prevents anal carcinoma, it prevents oropharyngeal carcinoma. We don't like to talk about sexual habits and sexual practices. Anal sex, oral sex, vaginal sex, everything is very, very prevalent. Take my words, बहुत कुछ उससे भी ज़्यादा prevalent है, आपको मेरे को पता भी नहीं होगा. एक 16 साल के लड़के को फादर ने बुलाया. One father said, बेटा आई थिंक तुम बड़े हो रहे हो, मतलब अब आई थिंक आई शुड स्टार्ट टॉकिंग टू हिम अबाउट समथिंग लाइक सेक्स एंड ऑल. So he said, beta, come. I think I would want to tell you something. We should discuss about sex. So he says, yes, Papa, please come. Tell me, what do you want to know about sex? 16 years old boy. So if you think you don't want to talk about anal sex and oral sex and vaginal sex, you are in a really, really, old timer, and you will pay a price. So getting the children vaccinated is very much important, and definitely HPV vaccine. Next, please. Necessary cause of cervical cancer. I think this is the best slide. 99.7%, my dear friends. उसके बाद भी अगर हमारे इंडिया में कैंसर से सर्वाइकल कैंसर से अगर लेडीज मर रही हैं तो गलती आपकी है, गलती मेरी है. मैं डायबिटोलॉजिस्ट हूं. व्हाट डू आई टेल माय पेशेंट्स? Diabetes comes because of inactivity, because of laziness of the patient. And the complication comes because of the laziness of your doctor. Complication prevent करना आपकी मेरी जिम्मेदारी है साहब. Vaccination देना आपकी और मेरी जिम्मेदारी है. Next, please. Hepatitis B, we all know it. What do you should do it? साल में एक बार अपने सैंपल देते होंगे. Please give the sample of anti-HBs titers always. Less than 10 है, एक इंजेक्शन लगवा लीजिए. Very simple. Next, please. Next. Hepatitis A. So much talked about it. I am very happy. I've been giving BioVac A China product. Somehow I am anti-China. तो गाड़ी भी जब खरीदनी थी EV, I was the first fellow to got EV in Hyderabad. तो it was different. The thing between MG की लूँ कि टाटा की लूँ. मैंने कहा Be Indian, buy Indian. I bought Nexon. So the only reason is MG, I thought is a Chinese company, so I left it out. Be Indian, buy Indian, and stay Indian is what I say. Next, please. Pneumococcal infection, everybody should take it, especially if you're a smoker, if you're a diabetic, if you're more than 50 years of age. Next, please. Schedule single shot Prevnar followed by pneumococcal after 6 weeks to 8 weeks. Next, please. Flu shot, very much needed. I believe on this more than any vaccine, even during the COVID time. I have given this vehemently to everybody. I have taken myself, and especially for the ones who said they will not take COVID vaccination, like flu lagwa lo. Flu and pneumococcal vaccine lagwa lo. And take my words, all of them are still alive and well and doing good. Flu vaccine is very important for all of us, especially for the doctors. Especially for the doctors. Patient तो आके मुंह में खांसता है. हमारे MLA साहब अभी खांस रहे थे. कहते I was नहीं his words only. He took a treatment from me. He said कि डॉक्टर साहब मैं जब कमिश्नर ऑफ पुलिस था तो लोग दूर से बात करते थे. कमिश्नर के पास आने से हर कोई डरता है. कमिश्नर और बीवी हर कोई इन दोनों से डरते हैं. तो he says कि now मैं जब से MLA बना हूँ बिल्कुल बगल में आके खड़े होते हैं मुंह में बात करते हैं. And they tell सर मास्क हटाओ फोटो के लिए मास्क नहीं होना है. तो poor gentleman was coughing. I just got a CT scan done for him as a nice friend of mine. Next, please. Meningococcal meningitis. एक केस आप एनकेफेलोमाइलाइटिस का मेनिंजाइटिस का देख लीजिए. जिंदगी भर आप ये वैक्सीन हर किसी को देते रहेंगे. अगर हम मेनेक्ट्रा बोले तो 5,000 रुपए की है, बाकी वैक्सीन 1,200-1,500 के आसपास है. प्लीज गिव इट. इट्स अ सिंगल शॉट वैक्सीन एंड यू विल डेफिनेटली नीड इट इफ योर चाइल्ड इज गोइंग टू US एज पर द गाइडलाइंस. नेक्स्ट प्लीज. Schedule, we all know it. Next, please. Yellow fever vaccine, only given in IIPM, especially if you're going to Africa, you need to take it. One shot, 10 years efficacy. Next, please. रेबीज, ओके, थोड़ा सा टाइम मैं चाहूँगा साहब. वी ऑल आर डॉग लवर्स. मेरे घर में 3 कुत्ते हैं. आई एम रियली टॉकिंग अबाउट माई pups, not the boys. I have 2 boys otherwise. They sleep with me. I'm talking about dogs this time. Vaccination of rabies is very, very important. सिर्फ इंट्राडर्मल दोनों आर्म्स में लगाना है, and then one after 1 week. Abhairab is very well available. Take it whichever is available, but vaccinate yourself. Why you have to vaccinate it? Highest death in the world are India. 70,000 deaths होती हैं, उसमें 50% are always Indians. That means 35,000, that means 100 per day. 100 deaths in India per day because of rabies. क्यों? क्योंकि आपने और हमने जो पेशेंट आते थे जिनके पास पेट्स हैं उनको वैक्सीन नहीं लगवाया. कॉस्ट ऑफ द रेबीज वैक्सीन साहब यहाँ की एक कॉफ़ी से भी सस्ता है, 500 रुपये से भी ज़्यादा नहीं है. प्लीज़ टेक इट, प्लीज़ गिव इट. नेक्स्ट प्लीज़, नेक्स्ट प्लीज़. ओके, COVID vaccine, I'm really scared to talk about it. We all have heard about it lots and lots. Next, please. Travel vaccination. If you are planning to travel, these are the vaccinations you require it. Don't have to take picture of this. Google it, put the name. Travel vaccination needed for South Africa, and you will have the full list by CDC. Follow that. Next, please. Next, please. This is important because obviously there are a few reasons. Next, please. So vaccination needed for Hajj pilgrims. Take my word, इसकी पूरी कॉस्ट जो होगी वो 15 से 20,000 रुपये होती है. And it's worth investing, making sure your patient invests in it. Because somebody who is going for Hajj, you don't want them to come back with a disease, and it's very easily available. Again, somebody who is planning for Hajj, अगर आप हैदराबाद में रहते हैं, you must offer them before in advance. Next, please. हाँ, ये बात हो रही है आपकी और मेरी. This is about you, about your mother. When the COVID was there, when I used to come back after seeing COVID patients, I was left separately. Why? मेरे से मेरी वाइफ को होगा, वाइफ से बच्चों होगा, फिर मदर इन लॉ को होगा. She was 85 years of age. I isolated myself. वैक्सीनेशन ले लीजिए, आइसोलेशन की ज़रूरत नहीं पड़ेगी. Hepatitis B, influenza, MMR, varicella, Tdap. I don't know why the person who made the slide उसने hepatitis A नहीं डाला है. I sincerely believe hepatitis A should be taken by all of us. Next, please. This is ACIP, adult immunization schedule. We all need to follow. Next, please. ACIP India, almost same guidelines. Next, please. Next, please. For travelers to India, why do we need to have it? This had to be shown to the foreigners. Next, please. एक चीज़ मैं आपको बताऊंगा, ये जो स्लाइड मैंने प्रेजेंट की थी, I have usually done it for elderlies, for the parents. पेरेंट्स के लिए मैंने ये स्लाइड बनाई थी कि अगर आपके पेरेंट्स को क्या वैक्सीन देनी चाहिए. डू यू नो व्हाट किल्स एल्डरलीज एंड पेरेंट्स द मोस्ट? एनी आइडिया? आई एम टॉकिंग अबाउट योर पेरेंट्स. आई एम टॉकिंग अबाउट माई पेरेंट्स. नेक्स्ट प्लीज. व्हाट किल्स एन एल्डरली मोर? अ सेंस ऑफ बीइंग अनकेयर्ड, unloved, and unwanted. Make sure you call up your parent every day and tell them you love them. And definitely in this era, even to your son and a daughter. Just them knowing ki haan saab, you are providing fees does not work out. They need to hear it that you love them. And definitely to spouse also. We become so casual that we forget telling them. But when I say spouse, I'm talking about your own spouse. Don't say to anybody else. May God bless you all. Thanks for your kind listening. I really loved your attention. Any question about any vaccination, I'll be very happy to take it. Because yes, if you would want to say, have vaccinated people manage much more than community medicine guys or pediatrician. About adult vaccination, I'll be very happy to take any case.
What are the current guidelines for post-exposure vaccination against hepatitis B? Hepatitis A, sorry.
Post-exposure
vaccination.
That's a very good thing. I usually do not give them anything till the time they become completely normal. You have asked a very good... Sir, your good name please, sir. Dr. Jaiswal. Can you have a big round of applause for Jaiswal sahab? देखिए साहब, अति का भला न बरसना, अति की भली न धूप, अति का भला न बोलना, अति की भली न चूप. एक पेशेंट को अगर इन्फेक्शन हो गया तो एकदम से थर्ड फोर्थ फैमिली वैक्सीनेशन लेने आ जाती है, नॉर्मल चीज़ होती है साहब. एंड देन आई आस्क सर आर यू ओके, कुछ आपको है तो नहीं? हाँ सर 2 दिन से हल्की सी खांसी हो रही. हल्की सी खांसी हो रही है तो आपको वैक्सीन नहीं देना है. वैक्सीन आइडियली शुड बी गिवन टू एनीबडी हु इज absolutely healthy and fit like you and me. If I have to give hepatitis A vaccination to anybody post exposure, I will give it only after 1 year. I would not try to meddle around. हम लोग कोविड को दूसरी वैक्सीन को मिक्स नहीं करते हैं, वैसे ही अनहेल्दी बॉडी को और वैक्सीनेशन को मिक्स मत करिए, क्योंकि ब्लेम बीमारी का होगा जो कि आपकी वैक्सीनेशन को लगेगा, एंड देयर इज खिचड़ी जो पकेगी. तो आई पर्सनली डोंट डू इट. आई यूजुअली वेट फॉर 1 year, sir. I don't give it. Yeah, personally, I don't give it. Any other question, sir? Sir, your good name, please. Dr. Roy. A big round of applause, Sahab. I think one of the bold people. It's really nice to have so many people from Kolkata. साहब ये बड़ा खतरनाक जो टेस्ट होते हैं हमारे इंडिया में, वो 3 सबसे खतरनाक टेस्ट है. एक तो वाइडल टेस्ट है. वाइडल टेस्ट साहब मैंने ज़िंदगी में कभी नहीं लिखा. हाँ, आरएमपीज हर लोग लगातार लिखते रहेंगे, वो कहेंगे सर आपको टाइफाइड है, आपको टाइफाइड है, आपको टाइफाइड है. इंडिया में साहब टाइफाइड नहीं हो सकता, क्योंकि आप एम्पेरिकल एंटीबायोटिक इतनी खा लेते हो. मैं पर्सनली टाइफाइड वैक्सीन देता हूँ, डायबिटिक्स को देता हूँ, ओल्ड एज को देता हूँ. अदरवाइज आई पर्सनली डू नॉट ट्रीट एनीबडी एज सच. बट येस, if you really want to give it, typhoid conjugate vaccine is the best, which gives you safety for 3 years or so. And after that, Typbar, that is the polysaccharide vaccine.
Nowadays, conjugate vaccine is the
primarily thing.
Primary. And second thing, just I want to know that if suppose I am having typhoid, I got IgM positive. Widal is not done over here. That it has to be done after 21 days at least of exposure whatsoever. So I am IgM positive and I was suffering from typhoid, and after that when I become well after having this infection, how many days or how many months or how many years should I go for this? I mean after exposure kitna din gap rehna chahiye kam se kam?
I will go with the same idea. I will wait for at least 2 to 3 months. When you are completely normal, I'll give you the vaccine.
Okay,
that's the thing.
Okay, thank you, sir.
Thank you.
Sir, how frequent outbreak of hepatitis A in India, and what is the management the same?
ये बात जैसे इस समय यहाँ पे डायबिटिक्स कितने हैं नहीं है मुझे नहीं पता, लेकिन हाफ से ज़्यादा प्री डायबिटिक्स बैठे हुए, उनमें मैं भी एक हूँ. हाफ से ज़्यादा प्री डायबिटिक्स हैं. तो एग्जैक्ट फिगर मैंने चेक करना छोड़ दिया साहब. आई ओनली गो विद वन डिक्टम, बी प्रिवेंटिव एंड प्रोएक्टिव सो दैट यू डोंट हैव टू बी रिपेंटिव एंड रिएक्टिव. Be preventive and proactive so that you don't have to be repentive and reactive. कभी भी मुझको डाउट होगा मैं डबल डोज भी दे दूंगा. हेपेटाइटिस ए की अगर आप 3 डोज भी दे दोगे तो कुछ नहीं होगा साहब. फर्स्ट डोज से 95% आता है, सेकेंड डोज से 98 आए. एनीथिंग एल्स, मैं वैक्सीनेशन प्रैक्टिस कर रहा हूँ 25 ईयर्स से. आई हैव बीन गिविंग फ्लू, न्यूमोकॉकल, रेबीज फ्रॉम 25 ईयर्स एंड टिल नाउ आई हैव नॉट हैड एनी इशू. टाइफाइड की सबने बात शुरू कर दी थी. Last month, one American had come, Indian American had come. So he was supposed to get 0.5 ml of dose. I think some nurse somewhere outside had given the full bottle. Full bottle is 2.5 ml. 5 dose उसने एक साथ दे दी थी. So he suddenly became uneasy and we admitted him. Next day साहब अब 5 times dose हो गया तो admit करके देख लिया था. Next day उसको discharge कर दिया. He was fine. अभी तक whatever experience I have had it, I have never had any issue with over vaccinating anybody. Under vaccination is a problem. Over vaccination, till now, my experience, no. I haven't read it, I haven't checked, experience wise, no, not at all. So I would suggest you, when in doubt, vaccinate. अभी एक बंदे को फ्लू लगवाया, आफ्टर 1 month आकर सर 2 महीने पहले ही वो लगवाया था. मैंने कहा कोई बात नहीं, you got double power now. So no harms, as per the studies wise, no harms at all. Any question? Sir?
Sir, those people those are going to Hajj for Hajj. they have to take lots of vaccines like
Yes.
hepatitis A, hepatitis B, polio, influenza. What we learned that we can take 100 of vaccine in a single day in different areas of the body. I mean, to make the seroconversion properly or within 24 hours. But in our country, the doctors are illiterate, where instead of that, the other peoples they have more knowledge of this medical fields and all. So if I want to put one vaccine after 24 hours, and the time we have we have very little time because they are going to Hajj they come actually
Last
1 or 2
moment
months.
पे आते
So what to do in that cases?
अच्छा, कितनी वैक्सीन एक साथ दे सकते हैं? 4 आप एक साथ दे सकते हैं. 2 हैंड्स है, 2 बटक से उससे ज़्यादा नहीं है तो प्लीज़ मत ट्राई करिए. 4 इज एनफ इज व्हाट आई विल सजेस्ट. कोई भी 4 दे सकते हैं आप. दिस इज व्हाट आई विल सजेस्ट. उसके 4 के साथ 5वां हो जाता है कभी कभी, क्योंकि बच्चे स्टूडेंट्स आते हैं टीबी टेस्टिंग के लिए, तो एक फिर वो इंट्राडर्मल वो भी हो जाता है. 4 से ज़्यादा साहब मैंने नहीं ट्राई किया. आई डू नॉट बिलीव 2 वैक्सीन शुड बी गिवन इन द सेम आर्म. एक इधर 2 डाउन, दैट्स इट. तो दिस इज व्हाट आई यूजुअली फॉलो एंड दिस इज व्हाट इज परमिटेड एंड आई स्टिक टू दैट साहब. फिर वो क्या होता है सब, जैसे सेकेंड डोज 28 डेज के बाद आनी ना, तब तक उसका हैज खत्म होकर के आने दो, फिर उसके बाद आप दोबारा दे दीजिएगा. सर देखिए, मैं आपको ऑनेस्टली बता दूं, हमारे डॉक्टर्स के साथ बड़ी परेशानी क्या है, वी आर ओवर इन्वॉल्व विद द पेशेंट. हमको सर जितना वो चाहता है उतना कर लीजिए, उससे ज़्यादा नहीं करना, उससे कम नहीं करना. ट्राई टू अंडरस्टैंड दैट पॉइंट. पेशेंट क्वाइट ऑफन कम्स ओनली टू टेस्ट योर नॉलेज लेवल. ही नोज उसको क्या दवाई है चाहिए, बीमारी भी क्या है. से ट्राई टू अंडरस्टैंड दैट वेरी वेल. एंड एक चीज़ और, आई एम वेरी वेरी हैप्पी. I would want to talk to you any time and come and connect with me. That's advice.
Yeah, sure. Actually, my father is a doctor, so I'm inspired.
You should be. You should be. But अपने पापा को कह दो कि he should give me a call. I'll talk to him separately. Thank you. Thanks a lot. It's really nice to see such a big energy from young doctors. Can we have a big round of applause for her? Thank you, beta. People like her keep me comfortable because I work with Apollo Hospital, but I go guest lecture every Tuesday in Patna Mahindra College in Chevilla. क्यों? क्योंकि मैं चाहता हूँ कि जब मैं बीमार पड़ूंगा तो मेरे को भी राइट डॉक्टर शुड ट्रीट मी. सो कॉर्पोरेट हॉस्पिटल छोड़ करके भी एवरी ट्यूसडे आई गो एंड टेक अ लेक्चर देयर. सो लेक्चर देयर एंड CME लाइक दिस आर वेरी वेरी इंपॉर्टेंट and all of us should continually participate in it. Thank you, beta. Sit down.
Thank you, sir.
Thank you. James, where are you? Give this pen to that beautiful lady from my side. Yes, please. Somebody else had a question. Anybody else? I think we're overshooting the time, so thanks a lot for IIL, and we are looking forward for many more vaccination and many more interaction sessions like this again. May God bless you all. And before I close down, because I heard so many questions and vaccination is my passion, if you do not mind, I would want to leave my phone number to you and take my words. I would be very happy. You text me at 2 a.m., 3 a.m. I do answer all my patients, everybody. Don't call, only WhatsApp me. I am Dr. Ashish Chauhan, available at 810-612-7475. 810-612-7475. Thanks a lot. May God bless you. Namaskar.
Can you again have a huge round of applause for the doctor for making it such a lively session. Thank you so much, doctor, for throwing the insights on plethora of vaccines for adult immunization. So today's event marks as an incredible milestone. We are grateful for the shared commitment of public health and the groundbreaking launch of Havisure, India's first indigenously developed hepatitis A vaccine. Together, we embark on a journey towards a healthier and brighter future. Today, I feel honored and privileged on the behalf of entire Indian Immunologicals Limited to extend my sincere gratitude to our chief guest, Sri Nagaraj Karpan, MLA Telangana, Sri Ajay Mishra, IS Chairman, Indian Red Cross Society, Telangana. I want to express my sincere regards to our Honorable Managing Director, Dr. K. Anand Kumar, our Deputy Managing Director, Dr. Priyabrata Patnaik, Dr. Raghavendra Babu and the team of experts from Star Hospitals, Dr. Ashish Chauhan, Consultant Physician, Apollo Hospitals and Apollo Hospital, Secunderabad, and my heartfelt thanks to all the delegates who joined us from various parts of the country. I thank all the head of the functions of Indian Immunologicals Limited and thankful for the entire team for their valuable contribution in making the event successful. I also thankful for the entire crew for making this event successful. Now it's time to capture this remarkable moment, and let's take these memories to our future. I request all the esteemed guests and delegates to kindly join us for the coffee. We request all the doctors to be on the stage, sir, for a photograph for Havisure. Yeah, please. Requesting all the doctors